It's another beautiful day. A warm welcome to another episode of Today's Parent, where we connect with experts and provide you with information to make your parenting journey a bit more easier. I'm your host, Christine Kasina. Talking about connecting you with experts, in another episode, we had Dr. Wahome, who focused on sharing with us matters ENT, ear, nose, and throat infections. In that episode, we were not able to cover a lot of things, especially how we can manage ENT conditions, and we have Dr. Wahome back to share with us how we can manage common ENT problems. Dr. Wahome.
Yes, Christine.
A pleasure to have you once again.
It's a pleasure to be here once again. Thank you for having me.
It's a pleasure.
Thank you.
So when it comes to ear, nose, and throat infections, how do we manage them? Shall we start with what? We start with the ear infections?
That's fine.
How do we manage ear infections?
Okay, so, wow, there's so much to talk about, and I just hope that we can be able to speak about these things that can be very useful to the viewers.
Yeah, absolutely.
So first of all is identifying maybe what are risky infections, or what are the risks for these infections, and preventing them. In this age group of children, there are those who also they like to experiment. So they like to put things in the nose, in the ears, and so on, and that can also lead to infection. But in terms of identifying when there is an infection, we talked about the signs and symptoms that they have. Now, treatment or management includes either investigations and tied up to treatment itself, which could be medical or surgical.
Right.
So in terms of hearing loss, for example, at Prodigy, we do have very comprehensive hearing assessments for children of all age groups. So if a child has a hearing loss, then we are able to advise them early. Now, the brain, in terms of the hearing center, is very plastic, and the plasticity lasts up to the age of 5. What does this mean? If you have a congenital hearing loss, or you have a very severe hearing loss in childhood, you are at a significant risk of living through life as a deaf and mute individual.
Yeah, but if you can prevent it.
If it can be prevented, yeah. So if you can find out early enough, and we do hearing screening on children, we can be able to catch hearing loss in those children, and be able to improve it or amplify it to the point where the brain is still plastic. And these are children who can grow up healthy, normal lives without ever having the suspicion that they did not have an early childhood hearing loss. So hearing tests are important. Now, on top of those hearing tests, there is the treatment. So generally, all infections would, especially if they're bacterial, would require an antibiotic if they're bacterial. And there are blood tests that you could do in these children that would determine whether they're bacterial or not. Some of them are viral, and it is important, and that's why we say it's good to see a clinical person. If you have a middle ear infection or an ear infection or pain that is pointing towards an infection, sometimes it could be viral, in which case you will not benefit, or it will be not useful to give you an antibiotic.
Right.
So these blood tests help us to weigh and determine, is this a bacterial or a viral one. Any infection that has fever and so on, that would be the general treatment. So your pain relief medications that would lower your temperature, exposing the child if they're very hot, and those kind of things, and rest. And also soup, and those are plenty of fluids. That helps the children to recover. And then there's specific antibiotics which ideally should be prescribed for these infections. Unfortunately, the bacteria that cause middle ear infection are also the similar or same bacteria that cause tonsillitis and otherwise. So antibacterial therapy is across board, what will be a broad spectrum, which means it would cover any of these infections.
Right. And you know, Dr. you've talked about hearing loss, especially for younger children. If it's captured early, then there's a possibility of managing it and treating it.
Correct.
At what age would it be advisable for a parent, you know, to come in and see your specialist, you know, to possibly get help in good time?
At any age. And in fact, in Europe and many Western countries, they have the same way we have vaccinations and immunization schedules. All children at birth actually receive a hearing test, or what is called newborn hearing screening. We can do that in our clinic, and other clinics can be able to do that. So if you do a hearing screening, that can be able to tell you, okay, my child is fine, so rest easy. Or you can be told that we need to evaluate further and find out what is the significance of this hearing loss. And if you detect that, then you can be able to do something about it. Commonly, if you have a hearing loss that is correctable through surgery, we talked about middle ear fluid, or what is called glue ear. This is one of the commonest causes for hearing loss in children of that child, of that school-going age. So there are procedures that can be given, that can be done on these children you may have heard about ventilation tubes in the ear or even adenoids. So adenoids, children who have enlarged adenoids tend to be at risk to develop fluid in the middle ear or glue ear. So the procedure of removing adenoids in these children and doing what is called a ventilation tube placement in the middle ear, which means you drain that fluid from the middle ear, really rescues a lot of hearing loss in these children.
I wonder, the equipment that you use for hearing loss assessment, it sounds very intimidating. How does it look like when you come in for a hearing loss assessment?
Okay.
Do they put a machine in your, you've mentioned about the blood test, I'm
Correct.
just wondering, how do the machine look like, and how long does it take for, you know, to go through the test?
Okay.
How does it look like?
So first and foremost, it's more intimidating than it sounds. It's actually quite friendly. Now, hearing loss is divided into two types. One is called objective. Me and you can be able to communicate, and therefore the objective, all of it would require some headphones which are placed into both ears. It is usually done in a room which is a soundproofed room that has minimum noise so that you don't distract. Now when those headphones are placed, pure tones or sounds are transmitted to each individual ear at a time. And if you are a child who is above the developmental age of 5 years, you can be able to do that kind of objective hearing assessment. And that will be able to check and plot a graph of how your hearing is against the frequencies or different frequencies of hearing. So it will be able to give us a hearing level.
Right.
Now in children who are less than 5, in terms of developmental age, they may not communicate as well. They may be disturbing, they may be intimidated by those things, and therefore sometimes you need some level of sedation. So these children are given some medication that puts them to sleep and does what are called subjective hearing tests. But these ones will test the cochlea, and to 100% sensitivity will be able to tell us the kind of hearing loss that they have, or whether they have 100% hearing.
Okay. Our young people at the moment, a lot of us, I think I can call myself young, a lot of us young people wear earphones and headphones, especially earphones, like they were born with them.
Correct.
Are there any dangers of having, you know, earphones on all the time? Would you advise that we keep to a certain volume limit, or is there a way that our ears are able to regulate the volume? Absolutely.
And as I answer that question, I'll probably answer other questions that may come about the ear. Remember, we had spoken about the ear having certain parts. So there is the external ear canal. And that ear canal has glands that produce wax. And that's, you see commonly, people put in cotton buds to be able to clean the ears. Oh, I have not cleaned my ear this week, I need to clean. Or every time after a bath, I put in a cotton bud. We discourage that highly. The ears have a self-cleaning mechanism. This wax traps foreign impurities, materials of certain sizes, and is constantly being pushed outwards to fall off. So the act of putting in a cotton bud in the ear canal is actually pushing in some wax inside, and also traumatizing to the extent where you could actually develop external ear infection.
So we shouldn't put the earbuds
inside the ear. Yeah, when we say the biggest thing you should put in the ear is your elbow. If you're able to do that.
Which is not possible.
Yes.
So that means outside, even outside the, of course, inside the ear, just around.
Correct. Yes.
You're not supposed to
around
do
the
that
meatus or the follow. No, that you should not. So you should just clean. You can put a cotton bud around that area.
Okay.
That's fine. Or your usual towel, especially if you're washing children.
Yeah.
The way they say wash at the back of the ear or around the ear, do that. As a home remedy, one of the things that helps mothers, and I think this is really important, or parents, would be if you see, because you might look and see, oh, I can see like there's a bit of wax in my child's ear. As long as they're not complaining about it or in pain, olive oil is a very good home remedy to place into the ear. It's medicinal, it's does not react to the external ear canal, and it actually softens wax enough for it to fall off. Now back to the question that you asked about hearing, the headphones.
Yes.
Now, earplugs versus headphones. There's an increasingly high number of hearing loss amongst teenagers or in the age group of between 12 and even 20 years of age because of using of earphones. We discourage earplugs highly.
Earplugs?
Yes.
The ones, of course, that go in.
Yes. And the reason for this is very few of them would be well-fitting. And because of that, there's some escape of sound. And that will always encourage you to actually place, to increase the volume to unacceptable sound hearing levels. And if you have continuous excessive volume or sound to the ear, then that will eventually lead to hearing loss because of noise or noise-induced hearing loss. And these children are getting that, or these youth are getting that. If you must listen to music, we always encourage good headphones. And the reason for that is twofold. One, the headphones block or mask out external sound. So you'll notice for a particular song or a sound, you need to listen at a lower volume, which is more towards the normal physiological volume, which is appreciable for you, as opposed to having an earplug.
Okay.
And even for just general safety, walking around in earplugs and stuff, it makes it a bit unsafe. So we discourage the use of earphones. They also push in a bit of wax on the inside of the ear. They can also traumatize the ear canal and lead you to noise-induced hearing loss.
Well put, Dr. Let's talk about now how we manage nose infections, be it nosebleed, running nose. What pointers do you have for us? Okay,
so as a pointer, remember nose bleeding. Stop your children from picking their nostrils. That will help a lot. And then you want to manage depending on the amount of nosebleed. Some nosebleed is really severe if you have a whole sheet that's filled up or it's continuous for a long period of time. We know that clotting takes place within 3 to 5 minutes. So if that is not happening, or the child is nosebleeding from both nostrils, then that is severe enough to warrant going to the hospital. Okay. There is nosebleed that will not be so worrying, and not after trauma, maybe because of an infection. What is most important is to understand what kind of first aid do we do in nosebleeding. And the proper first aid is actually to pinch your nose and lean forward.
So pinch your nose and lean forward. And normally, most of us lean backward.
Yes, most people.
Make the blood go back out.
Yes,
so
exactly.
It should be forward.
It should be forward. Yes, and the nose should be pinched tight, because remember we had talked about the blood vessels which are coming into the septum at towards the middle at the front.
Okay.
Yeah, towards the middle at the front, and that forces you to mouth breathe. Lean forward for about 5 to 10 minutes, by which time clotting should have taken place. After that period of time, if the clotting has happened, then you can clean up the nose, change clothes and everything else. On top of that, there is a medication called liquid paraffin. It's found over the counter and even in the supermarkets. Liquid paraffin is very nice because it causes a reduction in dryness. So whereby you have a clot from a nosebleed, the liquid paraffin will soften that clot, and it will help that surface where you had a breakage that caused nose bleeding to actually heal properly. So applying liquid paraffin into the nose as you maintain constant first aid might reduce the nose bleeding to a point where it doesn't happen again. If it persists, please see an ENT, because you might need to have what is called cautery, or what in layman's terms we say burning of that area of the nosebleed. There are other more severe causes for nosebleed that may require to be investigated, including what we had said, like coagulation disorders. In terms of running nose, a running nose can be disturbing for many reasons. Now, if you have a persistent running nose, we need to find out what is the underlying condition. Is it associated with allergies? And if it is allergies, what we need to do is to identify what are the allergens or the things that are triggering these responses. Commonly, you have dust, what is called house dust or mites, so an unclean environment. So just simple dusting, using of cotton duvets instead of blankets that are traditionally used, keeping the child warm, cleaning surfaces, cleaning carpets, or withdrawing them altogether, withdrawing pets. Those help and go a long way in helping allergic rhinitis or running nose from allergies. On top of that, if it fails or you don't get adequate treatment, then there are nasal medications that can be applied, like nasal steroids, and there are also antihistamines or medications that reduce the allergic response. If it is because of an infection, which means the nature of the discharge is a bit colored, it's a bit yellow, associated with headache, maybe fevers and so on, what we had described as sinusitis, then that requires adequate treatment. And commonly, it tends to be bacterial, and you might find you'll need an antibiotic for at least 2 weeks.
Okay. Yeah. Doctor, we're going to take a short break, and then I'm sure when we come back, we'll hear more from you. Especially, I know one common question we get is how to treat sinuses and to manage them as well. So let's take a short break, and then we'll be back.
Thank you very much.
In today's episode, we have Dr. Wahome back. We are focusing on matters ENT, and today we are talking about how we can manage ENT conditions, treatment, and importantly, even before treatment, how to diagnose. I hope you've learned something so far. We are going to take a short break. We'll be back right after this. We are back with Dr. Wahome, and today's focus is on managing ENT conditions and what we can do at home, pointers that Dr. Wahome is going to share as we come back from the break. Dr. Wahome,
thank you.
I have a question that has come in from Teresa, and Teresa's question is, if my child puts, for example, a bean in their nose, is this something I should try and remove, or I should rush to hospital?
Okay.
Because I think why she's asking, a lot of parents, when our kids insert things in their ears or nose, we try to remove them.
Correct.
Should we or should we not?
That's a good question, and it's one of the commoner reasons why children are also brought, especially between the ages of 2 and around 5 years. They are very experimental. They'll play around with beans, beads, and so on, and can place them. First and foremost, as a caveat, hide those things away from that age group of children. We see a lot of girls walking around with beads in their hair, and we highly discourage it.
Oh, yeah.
Because the beads, whereas they might look beautiful, those are the same things that they put into their nostrils or in the nostrils of their friends. Now, the challenge with a bead going into the nose is that it can go too far, or it can get inhaled towards the back and go into the airway. Now, in the airway, it'll be it could become fatal or become a disaster. In the nose, if it's placed inside there, most times it doesn't cause pain, and therefore they'll not talk about it. So you'd be surprised that we actually see a lot of children with the bean or a sponge or an organic thing that has been placed in the nose, and the child just has a stinky nasal discharge for a long period of time, and when they come to see us, we realize they actually have a foreign body in the nose. So anyway, to answer Teresa, if you find a bead at the front of the nose, it depends how far it is. If it's at the tip, you can actually, and the child can be able to sneeze it out or push it out, that should be the trial. If they are not able to cooperate,
should you get to tell the child to try and sneeze it out?
Yes.
You should try and do that.
You should try and do that. Okay. Yeah. So you can block one nostril and ask them to blow out from the other one. If it fails, please take them to the hospital. Okay. And in the hospital, preferably, they should be seen by an ENT person, either an ENT clinical officer or an ENT surgeon. Why? Because we have very specific instruments which are not commonplace in every outpatient facility that hook around or are forceps specific for these things that can be able to grab them. Right. For example, to be able to grab a bean which may have been in place and is likely to break into pieces, you need a very different piece of equipment as opposed to a bead which is hard and firm. Okay. Yeah.
Speaking of tips that you can share with our parents, sinuses, how can a parent manage sinuses at home?
So sinusitis is an inflammation of the sinuses and usually is continuous with the rest of the nose, what you call rhinosinusitis or the flu. So plenty of fluids to drink would be good because then they are at risk of dehydration, controlling fevers, and over time, if you're talking about sinusitis that has been persistent for a long time, is it because of allergies? And if it is, then allergen avoidance, use of nasal steroids, and also use of antihistamines. If it is ineffective, then of course using an antibiotic for a prolonged period of time. Okay. Steaming really helps a lot.
Steaming?
Yes, and steaming you can use either your eucalyptus oil, which are usually found over the counter, or certain prescription medications that can be bought that are mixed with steam water. And after you boil a kettle, you can either put it, pour it or empty it into a sink or a bucket. You can even play with a child where you actually lean over, protecting them from that hot steam. But when you've placed the eucalyptus or oil inside the steam of Vicks or one of those other emollients that you have, you can be able to steam a child. Steam helps to loosen secretions and also to open up the nasal airway, making them more comfortable. If you've had a child who has a real nasal blockage and a thick mucus discharge, you can appreciate how uncomfortable they'll be even listening to them sleep. So that really gives them comfort. And if you are comfortable enough to allow secretions to be flowing, then you get to improve faster.
Okay. Sinuses, can they be treated or is something somebody manages for life?
Yes, sinusitis should be treatable, and this is called acute sinusitis, meaning problems with the sinuses less than 3 months of age. Remember what I had said about sinuses not being very well developed in children. Now, there are practitioners who would tell you that you require sinus surgery. We discourage that very highly as a Kenya ENT Society. Instead, in children who have enlarged adenoids, Remember, we had talked about the ones that cause snoring. Now, if you have huge adenoids, they also are obstructing the passage of the nasal mucus, meaning we all produce a lot of mucus. We are constantly swallowing it. If you have huge adenoids, one of the symptoms that parents talk about is huyu mtoto homa yake haiishi. They're always getting a running nose. So mucus tends to stagnate towards the back of the nose because it's not flowing out, tends to get infected and gives you recurrent sinusitis. So as a minimum, in terms of surgery for recurrent or persistent sinusitis in children, adenoid surgery can be useful, but not sinus surgery, just adenoids.
That is good to know.
Yeah.
Throat infections. We commonly try garlic, honey, lemon, commonly known as dawa.
Yeah.
Does it work or it's in our heads?
Yes, it does.
It does,
It does work, and I would encourage any of those things, especially since they are organic in nature. If possible, freshly pressed. Those are good medications that help, or rather, category of excipients within those products are useful. Steaming would obviously be helpful, gargling, salt water gargles, and so on. But if it is bacterial and a blood test has confirmed it, of course, you need to augment it with an antibiotic.
Yeah. Can you give a child dawa? You know, hot water, lemon, ginger?
Yeah, especially, yes, you can. And especially if you can comfortably take care of the temperature so that they don't get a burn, that is quite good. And it's quite in order, and I think we can encourage that.
Even a 3-year-old?
Yes, even a 3-year-old.
That's good to know.
Yes.
That's good to know.
Yeah. But in terms of the consistency of the sore throat, again, as a home remedy, keep away from processed sugars. That means sweets, sodas, soft drinks, especially the juices that have to be mixed with water. Natural juices at whatever temperature are quite okay, and also fresh fruit is quite fine.
Okay.
Yeah. Sugar, which is natural, is not a problem, including sugar cane.
Okay.
Yeah.
Managing sore throat at home, have you covered it under dawa, or do we need different tips for that? Just managing sore throats and when you need to, rush to hospital if at all.
Yeah, I think with the dawa and also a pain relief medication like your paracetamol, ibuprofen, those ones tend to work. It's also good to take a peek at the throat, see how it looks.
Yeah.
If you find pockets where you can see things that look like pus, then I would encourage going to the hospital. If they develop a fever that's not going away after a day, then it's obviously prudent to be able to take them to hospital.
All right.
Yeah.
You did mention in our first episode that thyroid is something that we need to be very, to be aware of how it works. And you mentioned that thyroid conditions affect a lot of women. So what's the correlation between thyroids and, I don't know, the how women function? And then when it comes to thyroid conditions, because I know it's something that is very, very serious. At what point will somebody know that I need to see a specialist?
Okay. So the thyroid gland's function is it controls what is called the basal metabolic rate. Under control from the brain, the thyroid manufactures thyroid hormone.
Right.
And these thyroid hormones are a combination of iodine. And they help to regulate how the body's glucose is being used up. So if you have hypothyroidism or you have low thyroid hormone, then your metabolism is sort of slowed down. And certain things change. Your hair becomes brittle or breaks, your skin is unhealthy, even your mood changes. If you have excessive hormone production, then you have excessive activity, and therefore you have anxiety, your blood pressure rises, your heart rate is racing, and so on. And those are all, both of these spectra are not useful. Are a real problem. So first thing you need to do is, have you identified a swelling at the front of the neck? And that is significant. Yeah, so at the front of the neck,
should be at the front,
just at the base
okay.
here. If you have an anterior neck swelling or a front neck swelling, it's likely to be a thyroid disorder or an enlarged thyroid.
Anterior is at the front?
Yes, at the front.
This could be possibly goiter, if at all it's so enlarged?
Depending on how big, yes. So if you have a front neck swelling that is significant in size, then it will be visible. If it is visible, then you need to have it looked at. And one of the tests that would be done would be thyroid hormones. Just want to find out, is it a goiter that is overproducing hormone? And then on top of that, there's some imaging investigations that we could do, one of them being a neck ultrasound that will determine how big is the neck swelling, and is it on one lobe of the thyroid gland or on the other lobe, and is it independent, and so on. Now, depending on the outcome of these tests, then you could choose to have further evaluation or even surgery. But as a guide, if you find an anterior or a front neck swelling that is significant, just seek help, and you can be able to be guided on what needs to be done. Sometimes we do a watch and wait. Sometimes you need medications to either boost the thyroid hormone or reduce the thyroid hormone, and at some point you may require surgery.
All right.
Yeah.
Daktari, as we winding up today's show, your final tips when it comes to matters ENT, what can you share with our viewers?
Okay. So one is it's important for parents to remain abreast with what is going on. There are very useful tips. We do have useful tips even on our Facebook page for Prodigy ENT that they can go to as a resource, especially on children's conditions for the ear, nose, and throat, head and neck, and that can be useful for parents.
Absolutely.
There are certain home remedies and about a few tweaks that parents can engage in that will really prevent ENT disorders. Stay away from sugar, stay away from small things that children can put in their noses, their ears, or even try to swallow. Stay away from from small toys that have movable parts that can lead to choking incidents, and just stay healthy. But generally, if you need help, it is good to be sure that you're getting it from the right people, and that will be useful.
All right. And speaking about connecting with the right person, your contacts, if you can share with our viewers, how they can connect with you. Okay.
So we are found in Prodigy ENT and Hearing Clinic, which is on in KMA Center, which is on Mara Road in Upper Hill on the 3rd floor. And you can visit us also to see our contacts on either on our website or even on our Facebook page.
All right.
Yeah.
Thank you, Dr.
Thank you so much,
Dr. Wahome, for coming through.
We appreciate it.
Thank you so much.
Looking forward to having another chance to be able to speak.
I'm sure with the parents sending us SMSs, if there's any other issue we need to deal with, we'll be happy to invite you back.
Thank you so much.
Thank you for your time.
Asante.
And with that, we come to the end of today's episode of Today's Parent, where we had Dr. Wahome, and we had a conversation of how we can manage common ENT conditions, and if need be, when we need to see a specialist for diagnosis and treatment. I hope you've learned something. If you have any other further questions for Dr. Wahome, send us an SMS, and if you want us to connect you with him, we should be able to do that. Just send us an SMS and we'll see a way how we can connect you with him. I have been your host, Christine Kasina. This has been Today's Parent. It's been a pleasure having you. If you're looking for more parenting resources, go to www.supermamas.co.ke. We have been here in studio at Little Cribs, the home of fun, exciting, durable, and affordable kids furniture. And we thank you so much for your time. We look forward to having you next time. Thank you for watching.